Today we will talk about this multi-system inflammatory syndrome in children. This video is intended more for healthcare workers. We have a case of an 8-year-old presenting after full recovery from COVID that happened, let's say, 2-3 weeks ago. Now presenting with persistent fevers and then having some rashes over the body and feeling really weak, and then getting admitted to the hospital and getting really sick. Over 1,600 cases have been reported, 26 deaths as of early January, and the average age is around 8 years. It's happened also in the teenager and young adults. Black and Latino or Hispanic races are happening more in than other race, and also the definition of this case is having fever of over a day of 38 or 100.4 or above, having lab finding of increased inflammation, and having more than two organs involvement, and we'll discuss this more. We don't have a good reason, and then this person have some evidence that they have had recent COVID in the past prior 2 to 4 weeks. And then before we talk about the pathophysiology, we do have very two balanced system, the pro-inflammation and the anti-inflammation. We get an abscess, let's say on the hands or the foot, the body needs to respond with more inflammation, so we could help getting rid of the infection. Now the infection, we got rid of it. Now the anti-inflammation comes and cool things down. And these two systems are very well balanced. Now we get in trouble when one of these two systems get out of control, as of this syndrome. So with COVID, we are seeing three stages. The early stage, when we get COVID, and that's when we get just mild symptoms. Most of the patient gets the cough, congestion, the fevers. And then we get the pulmonary second stage, and this happens more in adults. That's when they get into trouble, when their oxygen goes down. They needed to be in the hospital, some of them, and needing to be in the ICU on ventilator support. The third stage is after we got rid of the infection. Now the immune system is making adaptive immunity to cause long-term immunity. And in this process, some of the patients end up having hyperimmune response. They secrete a lot of cytokines, and they call it cytokine storms, and we get hyperimmune response. With this so much immunity or hyperimmunity in the body, we get multiple organ being injured because of it. And we see mucosal inflammation, we see some meningeal irritation, some patients present encephalopathic, some patients present with some lung findings. And the one that makes us concerned the most is the cardiac involvement. So they present with shock and cardiac dysfunction. They needed some vasoactive support to help their heart and get basically help resolving the shock. We've seen some cases who had inflammation in their gut. Now, how do we treat it? Now, when we treat it by getting this hyperinflammation to calm down. And the way how we do it, we give anti-inflammation, we give steroid, and if a patient is really sick in the ICU, we give them pulse steroid, meaning 10 to 15 times the dose that we give for someone who has asthma exacerbation. And also we give the IVIG, immunoglobulin, and the steroid and the IVIG both would help protecting the heart from having coronary artery aneurysms and having long-term damages to the heart. And then if these are not yet effective and the kid is still sick, sometimes we do use some targeted therapy, like some medication to target IL-1 beta or IL-6. I hope everybody stays safe and use all the measures to protect themselves, their family, and their loved one, and vaccinate when able. Thank you so much.